Society for Nutrition, Education and Health Action, known as SNEHA, an NGO located in Mumbai, India. This NGO started in the 1900s by Dr. Fernandez, who worked in the NICU saving babies that were premature born in the urban slums. These mothers were lacking on the knowledge to be healthy, manage healthy pregnancies, and to keep their child healthy. She was concerned in releasing these babies, once healthy, to mothers that were typically living in an unhealthy, impoverished environment. Dr. Fernandez realized she had to empower these women and provide knowledge and give them skills to build healthier families. A small team of neonatologists went to the slums of Dhari to educate these women on nutrition, natal care, antenatal care, importance of delivering babies in hospitals, breastfeeding, immunizations. Their approach was to target large public health areas. These large public health areas are maternal and newborn health, child health and nutrition, sexual and reproductive health, and prevention of violence against women and children. They worked at a community level to empower women in slum communities to be the change and discuss with other public health systems and care providers to create improvements in urban health. They would also target care seekers and care providers in order to make this NGO succeed. This is a diagram demonstrating their life cycle approach. So their layout for the approach of the program was, in order for there to be change in the slum communities, there was a need to reinforce public infrastructure. To do this, they would sensitize the police, public hospitals, and legal systems to protect women and children. They'd improve skills of public hospital doctors to provide maternal and newborn care. They would train government outreach workers to screen and treat malnourished babies, refer newborns with danger signs to hospitals. They would empower these marginalized communities by creating safe living environments, empower couples to make informed family planning decisions, help families access appropriate health care during pregnancy, screen for malnourished children, and provide treatment and educate mothers to appropriately feed their children. I interviewed a lady named Sharmila Kaur. I was unable to Skype due to their policies. I asked her a series of 10 questions. The first question was, what kind of work do you do for this NGO? She replied, I look after communication and fundraising. My second question was, what is the most challenging part of your NGO? She replied, fundraising is our biggest challenge. The other challenge is that we work on the issue of behavior change. The idea is to encourage people to seek health, and that change takes long and involves strenuous, committed effort. This is an exciting challenge. How do you think the global health issues that SNEH has compares to the United States? She replied, we cannot compare the two as we are a developing country. Some problems, however, of violence against women and children pervade both countries. I asked her, do you see women that range from different economic statuses? She replied, we work primarily with women and children from vulnerable slum, informal settlement communities. Is there any policies that affect the work you do? She replied, SNEHA works in partnership with government, and the changing policy landscape does impact the way we work. The amount of children that are undernutrition that get help from SNEHA, is it common for the mom to breastfeed? She replied, the mothers usually breastfeed for a few months and then turn to complementary. At SNEHA, we encourage women to do compulsory sole breastfeeding for 6 months and then gentle introduction of solid food. Breastfeeding, however, should be carried on for 2 years. I asked her, what is the education level that is most seen from the women that need guidance in the NGO? She replied, the women come from all education stratas, but they would generally have a secondary school education. I asked Sharmila, the households these women come from, is there at least one person with a job? She replied, most of the households will have sole earners, but many of the women also work as house help or in informal sector, thus generating a dual income. However, the decision making is usually concentrated in the hands of male members. Are the economic and health benefits of education well established in India? She replied, India is growing rapidly, but the knowledge and attitudes are slow to change. The new India values the importance of education and is trying to ensure education for their children. However, patriarchal motivations means that girl children are pulled out of school and married off before they turn 18. My last question was, do you think power affects gaining access to healthcare and other services? She replied, women are marginalized and thus denied access, but with increasing awareness and with the active involvement of NGOs and community-based organizations in advocacy for their rights, more and more are finding the courage and the confidence to seek health. Some impacts that this NGO has is they have reached out to 8,000 pregnant women with potential of complications and over 30,000 normal pregnancies each year through partner hospitals. They have established 29 antenatal care clinics within government health posts, from which more than 2,000 low-income women are benefiting every year in total. And they have addressed over 3,500 cases of violence against women and children. They have screened 13,000 children in Mumbai slums. They've educated 7,000 women and 1,000 men in family planning methods and have trained and sensitized 1,200 police officers and cadets in Mumbai. This is my reference. Thank you for watching.